you come to the hospital, you're asked many questions. One of the most important is about your wishes for emergency treatments if your condition worsens. We do our very best to help care for patients and help them through serious illnesses, but sometimes patients get worse despite our best efforts. When that happens, it's very important that your medical team knows what treatments you want if you're critically ill. It is our goal to provide the best care possible and to avoid procedures that you do not want or that would harm you. It is important for your medical team to know and honor your wishes if you become sicker during the hospital stay. We have made this video to help explain treatments we use when patients suddenly worsen. This video can help you think about those choices and talk about them with your family and your medical team. You can change your mind at any time about your decisions.
You may have already thought about these choices ahead of time and have an advance directive or healthcare directive. This used to be called a living will. This document helps explain your wishes about emergency care when you can't speak for yourself and are in a life-threatening situation. Your hospital team should review this with you.
The most important question we ask patients is what they would like done if their heart and breathing stops. This is called a cardiopulmonary arrest. This is the most serious and urgent medical emergency we face. On the other hand, it is also a normal part of the dying process. People with advanced stages of illness may not want to have aggressive treatments when this occurs. Some choose to allow a natural death instead. This is a very important choice, and it should not be made in the moment. The treatment we use for this condition is called CPR, short for Cardio-Pulmonary Resuscitation. The question is, if your heart and breathing stop, would you want us to do CPR?
What is CPR? CPR is urgent medical care that may have to involve all of the following. 1. Pumping your chest hard enough to squeeze the heart so it pumps blood. 2. Electric shocks to the heart to reset bad heart rhythms. 3. Emergency drugs through an IV or a needle put into a bone. 4. Putting a breathing tube into your windpipe. We then use a breathing machine to get air into your lungs. These procedures can be life-saving. For people who are otherwise relatively healthy, CPR can restore life and allow for further treatments, hopefully improving your health. On the other hand, CPR can also produce pain and even injury. Ribs can be broken in the process, and there can be other complications. Unfortunately, CPR is most often not effective. Only about 1 in 5 of all people who have cardiopulmonary arrest in the hospital get well enough to leave the hospital. Outcomes are worse for those who have multiple or several medical problems. For these patients who have heart failure, COPD, kidney failure, or widespread cancer, less than 1 in 15 get well enough to leave the hospital. Recovery after successful CPR can be a prolonged and occasionally painful process. Permanent disability in patients with advanced illness is common.
The decision you make about CPR is called your code status. If you choose to have CPR performed, this is called full code status. If you decide that you do not want CPR, this is called do not attempt resuscitation, or DNAR status. This choice can be a very difficult, very personal one. Thinking about it can bring up a lot of emotions. Some people feel strongly that they would want every attempt made to restore life if their heart and breathing stopped. Others feel that this would be an indication that it is their time and would prefer a more natural death. These patients often choose not to have emergency procedures like CPR.
Sometimes patients worsen rapidly, but still have a pulse and are breathing. We also would like to know your choices for care if your condition rapidly worsens, but your heart is still beating. For example, if you develop a condition like pneumonia and are having serious difficulty breathing, you could choose to have a breathing tube and machine to support you. This is called mechanical ventilation, and the machine is called a ventilator or respirator. Even people who have significant illness have a chance of being able to improve on a breathing machine. Although this is often difficult to predict, it can be harder to get off the breathing machine if you have advanced lung disease, heart disease, or widespread cancer. It can be uncomfortable to be placed on a ventilator. For some people who are already very ill, this is an aggressive procedure that they would rather skip in favor of being made comfortable towards the end of life.
This video is intended to help you consider your feelings and decisions about CPR and other emergency care. No two patients are alike, and we respect that. Our first priority is to treat you in the way you want to be treated. So if you have any questions about this, please speak to your doctors here in the hospital. It is very important to us that we care for you in the manner that you want, and we need your help in order to do this. We are here to listen to your thoughts and help with this decision. Please talk with your doctor or hospital team if you'd like to know more. We can also put your wishes into your healthcare record to help teams that may care for you later on.